Hello, everyone, and welcome. My name is Dr. Jeremy. I am the Everyday Epidemiologist. On this channel, I post videos and host live streams where I discuss a variety of diseases and what public health professionals do to address and prevent those diseases. In these videos, I will get into the details of these diseases and illnesses, including causes, symptoms, modes of transmission, prevention methods, and treatments. I will also talk about what public health is, what people in the field do, as well as successes and failures in public health. I may get into some of the politics of public health and the challenges faced by the field these days. Much of this last topic will focus on issues in the US, as I'm in the US and I'm more familiar with what's going on here, but there will also be some international and global information and applications as well, because as you hopefully know, diseases don't care about borders. There are a couple of goals that I hope to achieve. The first goal is to share interesting information. Diseases and disease-causing organisms are fascinating, and many people don't know much about them, even if they have that disease. So, it's knowledge for knowledge's sake. But the main goal is to get good, scientifically supported information out there. Unfortunately, there's a lot of bad information, misinformation, disinformation, and just plain misunderstandings around. The bad thing about this is this bad information can and oftentimes does harm people. Scientists, doctors, and public health employees are not really taught how to talk to the general public about their areas of expertise. They are taught how to talk to peers in the field who know as much as they do. And unfortunately, when talking to the general public, much is lost in translation. And that is not the fault of the public. That is the fault of the scientists, the doctors, and the experts. We have failed for too long to meet you, the public, where you are and to speak in a way that ensures that we are understood the way we want to be. Science communication has been lacking for far too long. So I'm hoping to join the ranks of the better science communicators and share good information and help people understand what has long been poorly communicated. But first, I wanted to share a little bit of background about myself so you know who I am, why I know what I'm talking about, and hopefully why I'm trustworthy. My university education was in biology, with a specialization in microbiology and molecular biology. Things cell-sized and smaller, so very, very small things. While attending university, I performed 2 years of genetic research, attempting to discover the function of a gene in yeast. The final findings were more research are needed. After graduating, I worked for 2 years at the US National Institutes of Health, researching the genetic causes of medullary cystic kidney disease type 1. I then went on to earn a PhD in molecular genetics and genomics. My dissertation was on the genetic and biochemical causes of type 2 diabetes and diabetic complications. Much of my final findings were more research is needed. After that, I joined the United States Peace Corps. They sent me to Cambodia, where I worked as a community health education volunteer for 2 years. Without knowing it at the time, I began my career in public health. I worked with local nurses and community leaders to identify health concerns in the community and to develop and execute plans to try to address those concerns. My experience working in Cambodia convinced me to go back to school to get my master's in public health degree, specializing in epidemiology and global communicable diseases. I started this program in the fall of 2019, and as you know, shortly after that is when the COVID pandemic kicked off. So it was an exciting and interesting time to be getting into public health. I started working in the public health field officially in the spring of 2020 in a state public health laboratory. I would receive the tests for COVID, flu, respiratory diseases, and a variety of other diseases the state was monitoring, perform those tests, and report the results back to the county health departments or the doctors that sent us those tests. In early 2021, I transitioned out of the laboratory into a 2-year field epidemiology training program. As part of this program, I was involved in investigating a gastrointestinal or stomach disease outbreak at a local school, an outbreak of a skin disease centered on a local doctor's office, and I became very involved in the Mpox or monkeypox outbreak that started in early 2022. My work with the Mpox outbreak led me to my next position, working for a state health department as the state Mpox epidemiologist. Here, I oversaw the state's response to the outbreak. I was the point of contact for the county health employees, as well as public health officers in other states and at the U.S. Centers for Disease Control and Prevention, or CDC. While in this position, I also assisted in investigations into Lyme disease, malaria, and dengue, as well as performing surveillance on Ebola and Marburg. As the Mpox outbreak started to wind down, I left that state health department and took a position as an epidemiologist in a large county health department working with HIV, STDs, and hepatitis. My duties here include assisting the disease investigators to ensure that we have as much information about the cases as we can so that we can make sure our prevention programs are as effective as possible. I also manage and clean the data and generate reports so county officials can see disease trends within the county. So while I only have about 7.5 years of actual public health experience, if you include the Peace Corps, which I do, I've worked in a number of locations on many different diseases. I hope that through this education and experience, I have earned your trust that I do know what I am talking about and will provide you with good information. I do want to give a couple of disclaimers about this channel. First, I am not a medical doctor. Nothing in these videos or live streams is medical advice. Any medical advice you want or need should be obtained from your physician. Second, this information is being brought to you by me alone as someone who knows a bit about public health. It is not coming in any sort of official capacity from the county health department where I work. Third, all of the information provided in these videos comes from publicly accessible websites, books, and research articles. The sources will be linked in the descriptions for the videos, and all pictures and figures that were not made by me will have their sources shown on the screen. Fourth, I try to provide as accurate and scientifically based information as possible. However, I may misspeak or say something that is incorrect. If you catch me on this, please leave a comment with what I said wrong, and if possible, a source with the correct information, and I will look into it. If I was wrong, I will provide the correct information as soon as possible. Lastly, there will be discussions about people getting sick and dying, as well as pictures of people with the diseases, which sometimes can be fairly graphic. I will try to let you know before they come on screen, but I may forget, and for that I am sorry. So, with all that out of the way, one last thing before we get into any of these fun videos. I want to define a couple of key terms. Epidemiology is the science that deals with the causes, spread, distribution, and control of diseases in populations. An epidemiologist is someone who works in epidemiology. Public health, as defined by the World Health Organization, or WHO, is the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. Medicine and medical practice is a small part of public health. While doctors in medicine are focused on the disease and health of a single person, public health is concerned with the disease and health of all people, the public. With that, I am excited to bring you information about a bunch of interesting diseases and to share public health with you. I hope you find this as interesting as I do. Stay healthy, stay happy, and remember, public health is for the good of everybody. I'll see you next time.